aware that the session will be recorded. You are mostly all muted. If you're not muted, if you could mute yourself, but then obviously feel free to unmute if you have a question. We're also taking questions in the chat box, and we'll look at those questions and answer them at the end of the session. So as I was saying, we are going to cover information about why the insurance is important, why it's required, a little bit about the healthcare system, introduction to the Rollins Wellness Center and the services you can expect to have available to you there, and what are some of our local medical providers, and then we're going to get into the insurance plan. All right, so why is health insurance required? You may have heard in the media as they cover the U.S. news that the U.S. healthcare system is based mostly on a private healthcare system, and it can be quite expensive. And so most people in the United States have a health insurance plan to mitigate those high costs. And in order to protect our students, we mandate for anyone who is on a student visa or is a U.S. citizen who permanently resides outside of the U.S. to be enrolled in our plan. You will be automatically enrolled. You will see, and you may have already seen, that the health insurance premium has been added to your student account, and that's how you pay the premium. At the start of the school year, and Craig will explain more about this, you will get more information on your enrollment into the plan. And this really allows you to get access to great healthcare services without the extreme burden of the high costs that it would be without insurance. Because obviously for all of you, you want to maintain good health so that you can focus on your studies, which is the primary reason you're here, or you will be here. All right, so when we look at the U.S. healthcare system, what we first like to introduce students to is our wellness center. So Rollins has a wellness center that is free and available to all of our enrolled students, and they can do basic level medical care. They also provide health education, and as well in the wellness center we have our counseling and psychological services available. You can get more information about the Wellness Center at rollins.edu/wellness-center. And you can certainly navigate to that from the main page. But if you explore there, you can get a little better sense of all of the services. They are staffed by nurse practitioners, and those nurse practitioners are able to certainly do a wellness check, but also treat you for basic illnesses and prescribe medication as needed, and that is on our campus for your use. The next level of care that you would generally try to seek, unless it is an emergency, would be to use a private doctor's office. Private doctor's offices are going to be your next level as far as cost, so they will be the least expensive of the following different types of healthcare and medical providers that we're going to explain. What we recommend to students every fall when new students arrive, we advise that you look for a local private doctor. This will help you to have a doctor you can go to when you become ill, or especially if you do have an ongoing health issue that you need constant medical care for. It's advisable that you have someone locally to assist. I know that many students find comfort in continuing care with doctors from home, which is fine too, but we do advise that you try to find local doctors. And the nice thing about if you establish a relationship with a local doctor is that when you are sick, they're going to be able to see you much more quickly than if you aren't a patient. And then if you're not a patient of a private doctor, Your next level of access to healthcare, again, non-emergency, would be to access what we call an urgent care provider. So urgent care providers are like a walk-in clinic that you might be familiar with at home. This is not where you would have a specific doctor who would know your health history. You would see whichever doctor is, on duty that day. But certainly they also have expanded hours. So even if you have a private doctor, you may choose to go to an urgent care at times, especially if it's late in the evening outside of your doctor's working hours, or on the weekends if you can't wait until your doctor's office opens. So our nearest urgent care providers include Advent Healthcare, CentraCare, the GuideWell emergency doctors, and also Walgreens healthcare clinics. Those are just a few, but there are a number of different providers, and we're going to introduce to you how to search for those providers that utilize your where you can utilize your health insurance. And then if you will, your last resort, if it's not an emergency, although honestly, if it's not an emergency, you should not access the emergency room at a hospital because the insurance will likely not cover that. So our hospitals are used for true emergencies. So anything that's a life-threatening ailment or a severe accident where you need immediate attention, that's where you're going to go. And in the United States, to access emergency medical care, you may know that you dial 911. If you are living on campus, you can also call campus security, and they will call 911 for you. Either way, the most important thing is that you access that immediate healthcare service in an emergency. So your insurance will cover emergency services. There will be some copays, and Craig is going to introduce you to more of those different requirements of the insurance later. But do note that our hospitals nearby, there are about 3 major hospitals that you can access quite close to campus. So Advent Health has 2 hospitals within a close proximity at Winter Park and Orlando. And then there's Orlando Health System and the Orlando Regional Medical Center. So there's 3 major hospitals that you would have access to nearby campus. So I mentioned that Craig, our insurance broker, works for Insurance for Students. They have actually been our partner on our international student health insurance plan for many years. They work for both Rollins and for our students. So they are there to assist you with your health insurance and understanding how the insurance plan works. But usually, if a student has questions or challenges, we kind of work together, right? So between Craig and I, we can assist you through the process. I do want to also note that at the beginning of the school year, we will be having another insurance session that is part of orientation, and we will get into likely more details at that time, because certainly we don't expect you to leave here today fully understanding how to utilize the health insurance plan. But our goal really is to give you a basic understanding of why the plan is necessary, and then sort of how it will function and what you can anticipate in the coming months as the school year begins. And so I'm going to turn it over to Craig. You can see his contact information here, and he's going to introduce you to more details about the insurance.
Thank you very much, Jennifer. Yes, my name is Craig Bodie, and myself and our company, Insurance for Students, has been working with Rollins College international students for many years. And the big reason behind it is, unfortunately, kind of simple. The healthcare system here in the U.S. is complicated. expensive, and health insurance is complicated. And I think if you took a poll of just most people living here in the United States, they'd probably have to say that they don't fully understand how their health insurance works. So we're a team here at Insurance for Students, and we're here to assist Rollins College students. So whether it's something complex, such as you've gotten a bill that isn't making a lot of sense to you, or how do I find a doctor? We want you to reach directly out to us because that's what we're here for. We're located here in Florida, a couple hours from the Rollins campus, and we're open Monday to Friday, 8 to 5. Anybody here can assist you, but of course, I always invite you to reach out and ask for me, Craig Bodie. So we have a health insurance program here for Rollins College through Wellfleet Insurance Company. And this is what is considered a fully ACA compliant health plan. It's a health plan that I wish I could have. Jennifer would probably say the same thing. It is an outstanding, unlimited overall benefit health program that uses a nationwide network of doctors, which means students are able to choose who they want to go see versus a doctor having to direct them to each provider. So this is really a top level program, and we want you to reach out to us for questions because we want you to be able to get the most use out of it, and we want you to be able to stay properly on top of your health. For continuing students, the coverage is going to start on 8/15, and for new incoming students, it's going to be 9/7. Also, if you're a U.S. citizen living abroad, your coverage would start on 9/7 to coincide with the start date of classes of 9/14. There's nothing that you have to do. Your enrollment is automatic, as is the charge on your student accounts. There's nothing further that one needs to do. If you have your own comparable health plan, the date to waive out, the final date to waive out would be August 15th. So as far as where you can find all of this information, it's located at that website there at the top of your screen, Insurance for Students /Rollins. And I'm going to go over a little bit of that information. When you go to that website, you're going to see three link options to select. If you're attending Rollins College on either F1 or J1 visa, you're going to go ahead and make that top selection there. If you're a U.S. citizen who lives abroad, you're going to select the middle link there. And of course, below, if you're a current student and you need to look at coverage for the 2019 school year, you have that option as well. So once you make your selection, you're going to find your program information. The description of benefits is going to go over what your health plan covers and what your cost may be. Same with a summary of benefits of coverage. It's a kind of a uniformed look at your healthcare benefits. You'll have a frequently asked questions, and you'll also have program tools. Program tools is what allows you to see other benefits of the program, such as how to search for providers, which I think should be for, it's in the middle of the screen, searching for providers. Also, there's a list of local hospitals and urgent care centers. Right there towards the top, of course, is your Rollins College Wellness Center. My account, which I'm going to go over in a second, is how you access your ID card, as well as you can view, once you use your insurance, you can view the claims that were submitted. And then down towards the bottom, you'll see the alternate insurance waiver form, which again, this is where you would need to go if you have your own comparable health insurance and would like to submit a waiver.
So if I can just add in there, Craig, if you are considering submitting that waiver form, please make sure that you begin that process soon. As we mentioned, the August 15th deadline for submission of that. The waiver form, once you do access it, I think is quite easy to follow. It requires your health insurance company to complete most of the form, to answer some questions about the plan that you currently have. And then we will review those requests and respond to you with a decision on whether it meets our requirements.
So around the middle of August, towards the end of August, you're going to receive an email from your insurance company, which again is Wellfleet Insurance. This email, you see it up on your screen, it's a welcome email. And this email means that you are now, your information, your insurance is now in their system. And so there are some directions on the email that you're going to want to follow for setting up your insurance online account. And once you follow those directions, it's going to bring you to this screen. Again, you're in the Wellfleet Insurance portal system, and you would just go ahead and click on Getting Started. And it's pretty simple. You would just put in your last name, your Rollins student ID number, and your date of birth. And once you do this, this allows you to download and print your insurance ID card. You'll also notice towards the bottom of that screen, you'll see the mobile app. I find a lot of students like to use this. Just allows them to log in flawlessly from their phone. If they're at a doctor's office, they can show their phone to the doctor's office to get their insurance information. Also, it makes it easier to send your insurance information to a doctor's office prior to your visit. So it is vital that you set up that My Account to access your insurance information. So just to make this really brief, a couple of things that you're going to experience and want to keep in mind of when using your insurance. I mentioned that your insurance is through the Wellfleet Insurance Company. Really, the most important thing that you want to keep in mind is that the network your insurance uses is called Cigna. Cigna is a nationwide network of doctors and hospitals and specialists that your insurance uses. So if you were to call up a doctor's office to make an appointment and they ask, oh, what kind of insurance do you have? You would want to say, my insurance uses Cigna. Because that's what they're going to recognize. Cigna is one of the largest networks of providers, like I said, nationwide. So, and you are able to select any specialist, any doctor from that network of doctors. Again, this is a luxury here in the United States. Most people have to start with one doctor, and that doctor makes a decision of where they get to go. Not with this plan. If you have a friend that has a doctor that they really recommend, you simply want to make sure that that doctor's part of Cigna. And if they are, you can go to that doctor. So that is a luxury feature of this program, and something you always want to make sure that you do, that you make sure that whomever you go and see is part of Cigna. Deductible. Deductible is a small yearly out-of-pocket cost that you have before your health plan pays. This is a nominal amount. It's somewhere between $100 and $250 that you're going to pay first. After that, your health plan covers you to an unlimited amount. Now, that deductible is waived for your yearly physical examination, which we hope every single person here takes advantage of, whether you do it over at the Rollins Wellness Center, where it's going to be covered at 100%, or you go and select your own Cigna doctor and have it done there, where it will also be covered at 100%. Co-payments. This is something that you would have when you go to a doctor's office or a specialist or an emergency room, and it's just a small amount for that office visit charge. Same thing when you go and go to a pharmacy for medication. At the wellness center or your own doctor gives you a prescription because they want you to be on a medication. When you go to the pharmacy, you show your ID card and you would pay a copayment. For a generic, I believe it's $15. So that's a copayment. Co-insurance. After your deductible and copayment have been paid, your insurance pays at a certain amount, either 90 or 80%. Which means you then have a 10 to 20% of the bill that you're going to pay. So that's co-insurance. After you've paid a certain amount for the year, let's say you have something really major. Let's say unfortunately you come down with cancer, and now you have a $500,000 bill. You're not going to pay 10% or 20% of that $500,000 bill. No, you have a stop loss feature. It's called an out-of-pocket maximum, and that's the amount that you're going to pay. And I think that's between $5,000 and $8,000 for the year. So again, you have co-insurance up until your out-of-pocket maximum amount. And finally, EOB, explanation of benefits. Every time you use the insurance, the doctor's office or the hospital or your specialist is going to submit the bill directly on your behalf to the insurance company. Once the insurance company processes your bill, they're going to send you an EOB, explanation of benefits. They're going to do it by email, and they're going to post it to your My Account. And the EOB is going to explain how they paid your bill. You always want to pay attention to it. From time to time, doctors' offices make mistakes, and insurance companies can make mistakes. And if you don't follow your EOBs, there's a chance that something may not be paid correctly. If you get an EOB that doesn't make sense, or it says not covered, don't get upset. That is what we are here for at Insurance for Students. We want you to reach out to us. You can send me an email, you can give me a call. I'll ask you to please send the EOB over to me and any bills you have, and I'll review it. If it is paid correctly, I'm going to tell you that. If something looks like you may be right, that something's off, I'm going to have you fill out a little one-page form giving me permission to talk to the insurance company on your behalf, because all of your medical information and bills are private. The insurance company will not share them with me unless I have that completed form. Once I have that completed form, I'll then go to the insurance company and I'll have them relook at things. And many times we're able to get your bills reprocessed. And students that thought they were going to owe money realized that no, it was reprocessed and it was paid correctly. So that's why you got to follow up on your EOBs, because I do not have access to them. It is up to the student to review them and alert me when something doesn't look correct. So now I'll pass this back over to Jennifer.
Thank you, Craig. So that was a brief overview. I know perhaps it was a lot of new information. As Craig said, our healthcare system is complicated, and honestly, many U.S. citizens who live here full-time do not fully understand their insurance really until they have to use it. And even then, it's difficult. So the reason why we're doing this session is to give you an initial introduction and hope that over the next couple of months, as you have more questions, and certainly at orientation, as I mentioned, we're going to go into and navigate some of those portals to show you what you can access. As Craig mentioned, once you set up your account, you'll be able to access your ID card, and then there's also a link directly on the insuranceforstudents.com website where you can search for providers. But really, our goal today was just that brief introduction, and then also really to answer questions that you have. So as I mentioned, we do have the chat box available to you to pose questions about the plan, but also about the process. If you do have your own health insurance plan that is comparable to our plan, you can request that waiver. And so maybe some of the process for requesting that waiver is confusing, and so we're here to address those. I do want to also show or point out that on our screen you have our email accounts. So please feel free to email me or to Craig, and we'll be happy to answer those questions. And if you do submit the waiver request, it's going to go directly to Insurance for Students, and then we will together make that decision on whether or not it meets our requirements. So Diane asks whether or when do you pay your insurance fee. So on your student account, as you note, or if you haven't looked at it recently, you can access, it should show as an account already on your bill, and it will be due when you pay your tuition, when the tuition, room, and board fees are paid. And for undergraduate students, that date is July 15th, and then some of our graduate programs have slightly different payment deadlines. So you can check our rollins.edu page and search for student accounts, and that's where you can see the fee schedule and understand more about the dates specific to your program. So it's not necessarily included, Dan, in your annual fee. You'll see a line item, right? So when you look at your student account, if you're living on campus, you're going to see room charge, your meal plan charge, your tuition, and then health insurance will be separate, but it is due together with all of those fees. Let me look at the next question. Yeah, so I think we answered the first of the next questions as we. So if so the question is regarding whether or not student can actually obtain a student visa and arrive in the US. So absolutely, I recognize that these are challenging times and there's a lot of uncertainty for all of us, and the visa process is being complicated by embassy closures. So we had a session back in May, and I will reiterate some of the information that we shared there, which is to hopefully, if you don't yet have your Form I-20 or DS 2019, that you complete all of the requirements to obtain that, so that as soon as U.S. embassies do resume visa services, you're ready to go. But when those services will be resumed, I honestly don't have a specific response, because each embassy is going to open based on the circumstances locally. And we are tracking that through the U.S. Department of State website. But to be honest, you actually will probably have more up-to-date information being on the ground there than we do, because what we're hearing is from students that are saying they can get appointments, but when we look at the State Department website, it's not yet showing that appointments are available. And so just continue to monitor the situation at your nearest U.S. embassy. All that to get to your actual answer, which is that certainly if a student is not able to obtain a visa or cannot, for travel restriction reasons, come into the U.S., we will, excuse me, we will not require the insurance for the fall, and we would then charge the student for our spring summer rate, which would go into effect January 1st. Excuse me. And of course, that fee is prorated. So one thing we can let you know, which we didn't mention, is that as a new student, if you're a new student, because we may have continuing students on the call, but a new student is going to be charged, if they come in and enter for the fall semester, the annual fee. If you begin in the spring, you're only charged the spring and summer. If you are charged in the fall, you're not going to be charged again until the following fall, because of course you've paid the annual fee. If you are charged because you come in the spring, if you are charged the spring summer rate, you would be charged again in the fall, because that would then be, begin the new policy year for the fall or for the annual charge, and then you wouldn't be charged again until the following fall. Let's see the next question. So when do you need to create the account? You will do that right when you begin the academic year, because we are not able to get our entire roster of students to the insurance company until close to the start of the academic year, because of course students have until August 15th to submit that waiver and then have it reviewed. So once that is cleared, we'll have a better sense of, certainly anyone who's not going to be enrolled in the plan and therefore will be obviously enrolled. And then we'll send the roster to the insurance company. At that time, that's when you will be able to access the account to create the online account. So for now, there's really nothing that you can do except to look through insuranceforstudents.com/Rollins and begin to understand the schedule of benefits, so that description of the plan, also some of the program tools, searching for providers, and if you have a specific healthcare condition that requires a specialist, you will be able to search for providers specific to in relation, the location of Rollins, right? So you can do a search that will be, let's say within 5-mile radius of Rollins, and search by specific specialties. So if you have let's say a dermatological condition and you need to see a dermatologist and not just a general doctor, you can search for that. And you could start to begin that search now, so that you could establish, and set up an appointment for soon after you come into the country. So you establish your patient-doctor relationship.
Also, Jennifer, I'm going to jump in here real quickly. Keep in mind that once your information is live with the insurance carrier, you're going to receive that welcome email from Wellfleet student. So that's going to come close to the start of classes, admittedly, but that email lets you know that it's time to go set up your My Account and provides those directions to go do it. So definitely keep an eye on your email come the middle of August and on. May want to check your clutter or your junk. Sometimes it can end up there. But also, if for some reason you don't receive it, and again, now it's towards the end of August, you can always go to insuranceforstudents.com/Rollins. Make your selection, whether it's international student on F1 or J1 or U.S. citizen residing abroad. And when you click on program tools, you'll see the My Account link that'll take you to the setup.
And I have another question asking about the payment plan. Yes, the insurance fee can be included in your payment plan. So as you set up that payment plan, you can include all of your fees that are showing in your student account. So please have a look at the student account. If for some reason you don't see the health insurance fee listed there, please contact me and I can look into that with our student accounts office. The other question is asking to review how to create the student account. So that's what Craig was mentioning, that once the student receives, the Wellfleet email, which just to kind of review, please check your student email accounts. We will use your Rollins email account. So if you haven't yet transitioned to looking at your Rollins email account or even kind of set that up yet, I would encourage you to do that soon, because that's where the email is going to go. And so as Craig mentioned, close to the start of the school year, you'll get that email from Wellfleet, and you won't have access to setting up your account until that time. And so once that email comes, then you'll be given instructions in the email of the website to go to, which will be through Wellfleet. And that's where you'll be prompted to create a new account using your Rollins ID card, your name, and your date of birth. And then you'll set that up. And once you log in, all of your specific information will be listed, and that's where you can access your member ID card, which you'll need to use when you go to a medical provider. And as Craig mentioned, they do have a mobile app, which we highly encourage students to use, because of course then you have it readily available to you at the doctor's office through your phone. But please, understand we're going to go over all of this again in much more detail at the start of the school year. We include this in orientation, so please don't feel you have to fully understand it today. And so the question next I see is, if I decide to cancel my current insurance, will the insurance start to cover on the same day the plan starts? So if you are a new student, as Craig mentioned, your policy will begin September 7th. If you're a continuing student, it would be August 15th, and that's so that you have continuous care based on the usual academic year. As you know, we have delayed the start of this academic year, which is why the difference in the start dates. But note that the end date is the same, which means that in 2021, the new start will be August 15th for everybody. But so, yeah, I hope that answers your question. You will have coverage as soon as that policy begins on September 7th if you're a new student. No, Dan, you will automatically get it because we'll provide your email account information to the insurance company, and then they will have that to email you, so you don't have to do anything. Question is there a wait time? No, you have access from the date that policy begins. And note that Craig mentioned the ACA compliance. So ACA is the Affordable Care Act that was passed during the Obama administration, and it set certain requirements for insurance policies to cover. And so this plan is fully compliant with that, which includes no exclusion for pre-existing conditions. Craig, I don't know if like you can address the wait time, right? So I don't know if that's in relation to, I know some companies don't, you know, if you're using a company plan, you might not have access to that plan for a wait time, but this plan has no wait time.
That's correct. If you're a new incoming student and it starts on 9/7, you can use that plan on 9/7. There is no exclusion for pre-existing conditions. And as far as ACA, yes, that was passed back in 2010. And there's 10 essential benefits that must be covered to an unlimited amount. As an example, one of those is prescriptions. And then there's a lot of other things that fall under the ACA requirements. And it just basically, it ensures that people here in the US have excellent coverage instead of a plan that may look good, but then you look closely and something's not covered or something's barely covered. So that's why the ACA was passed, and this is just an outstanding health plan that we certainly want to make sure you get the most out of.
So Walter's question is in relation to if in the situation where a student, I'm guessing that the concern is regarding access to a visa and the inability to arrive for in-person classes for the September 14th start date. We will work together, Craig and I, to best accommodate what we're able to as far as prorating the insurance coverage. Certainly, if you're not able to arrive in the country, we will do our best to, determine when we could adjust that insurance start date for you. Because each student's situation will be challenging as far as, some countries, may have access to a visa sooner. I can't say with certainty exactly how the process will work, but know that we're committed to certainly not requiring you to have a plan that you can't necessarily use. And so, yes, so I would encourage you just to be in communication with me as you know more about your arrival date so that we can work with you on that. Right now, we won't be adjusting student accounts in relation to that until we have closer to the start of the school year, more specific. So if you pay your full tuition bill by the due date, then please note, that we would certainly, if needed, adjust it, and then you would have a refund. Is that correct, Craig?
Absolutely.
Okay. What other questions do you have? Was this helpful? We are recording it, so you can go back and look at the slides. I would encourage you to do that. If you weren't able to make notes, not to worry. All of this is going to be, it's available on our website. So the Rollins International Student Scholar Services website also has these links. And so we want to make this as readily available. And this recording is actually going to be posted on that International Student Scholar Services page, which is under current students. That's where you can access the health insurance pages. Anything else? We are ahead of schedule, which is always nice. So certainly you all have some extra time available. But also, I do want to offer, because we're facing a lot of uncertainty and our webinar that we had in May was now quite a while ago, and things continue to change. So if you have questions not related to insurance, but about the immigration process, you can certainly pose them now, but I also will remind you, you probably have received emails regarding the immigration webinar, just like this one. We're going to run it in July on Monday, July 13th. So please keep an eye out for emails and the ability to sign up for that. But certainly we're here online. I can do a WebEx. We can do a one-on-one chat as well. Craig is also available by email, by phone. We really just want to make sure that you have all of the information that you need. So thank you for joining. And we really do look forward to seeing you in September. And we hope that you have a great rest of your summer.
Thank you, Jennifer. I certainly look forward to assisting everyone going forward with their health insurance. We're certainly here for your questions.
We appreciate your partnership, Craig, and I know that we will together make sure all of you have good healthcare coverage. So
absolutely.
All right, nice to see all of you. Nice to see you again, Diane, and I look forward to meeting the rest of you soon.